Hi, I'm Dr. Todd Levine, and I'm the Medical Director of C&D Life Sciences. I'd like to take a few minutes to talk about how our new SYN1 test can be helpful in evaluating some of your patients that have unusual tremor types. In this short presentation, we'll discuss the value of diagnostic testing in the evaluation of patients with tremor and discuss the potential role of phosphorylated alpha-synuclein testing in these patients. Let's start with a typical patient of a 65-year-old male with a 7-year history of type 2 diabetes and a previous lumbar laminectomy who comes in because he's had a tremor for the past year. He states that the tremor began in the right hand and then progressed to the left. He says it can be present with action, but it is also present at rest. It is worse with stress or anxiety, and he has also noticed that his handwriting has gotten worse. More recently, he notices that his face feels a little bit tremulous as well. He feels off balance when he walks, and he has had a few falls. He states he gets lightheaded when he stands up. He does have a history of diabetes, for which he takes metformin, as well as gabapentin and lisinopril. On physical exam, his mental status and cranial nerves are normal. His motor exam revealed normal strength with no rigidity. He did, however, have mildly slowed rapid alternating movements in both hands and both feet. There was a mild rest tremor in the right hand at 3 to 5 hertz, but the tremor in both hands was worse with intention and was more like 6 to 8 hertz. When he walked, he had a decreased arm swing, particularly on the right. He turned 180 degrees slowly, but there was no shuffling or freezing. He underwent a brain MRI that was normal, and because of some of the Parkinsonian features, he had a DAT scan that was read as showing reduced uptake in the left putamen, and you can see mild reduction here indicated by the arrow. He was then prescribed a low dose of Sinemet 25100 TID. When he took this for a couple of weeks, he noticed that he had worsened orthostasis, he had a little bit of nausea, and he didn't notice any change in his tremor. He was then prescribed Artane 1 mg BID, again with no real change in his tremor. Due to the confusion of whether or not this represented a true Parkinson's disease syndrome, we ordered a SYN1 test to look for evidence of the phosphorylated alpha-synuclein. This test entails taking 3 small 3 mm punch biopsies that are done in the treating physician's office. Each piece of skin is run for H&E, which looks for inflammatory diseases in the skin, and in his case, none were found. We look for PGP, which is a stain for axons in the dermis and epidermis, and he did have reduced intraepidermal nerve fiber density, which is consistent with his mild diabetic neuropathy and the reason he takes the gabapentin. A Congo red stain was performed to look for amyloidosis, and none was seen. And we then did a phosphorylated alpha-synuclein stain, and this was normal. The conclusion of the SYN1 test is that there was no evidence of synucleinopathy in this patient. So how does this test help us? Well, what it tells us is that our patient who had a mixed tremor type with both rest tremor features and intention tremor features had a normal phosphorylated alpha-synuclein stain. This would argue against the finding of a synucleinopathy, despite the fact that he had a borderline abnormal DAT scan. In addition, he had no response to Sinemet or Artane, which would also argue against a diagnosis of Parkinson's disease. So in his case, this normal SYN1 test provided the patient with reassurance that this is a disease that is not likely to be Parkinson's disease and obviates the need for more treatments directed towards Parkinson's disease. We hope this brief case report has been helpful and identifies ways in which patients that have confusing or mixed tremor types can benefit from having the SYN1 test to see specifically pathologically whether or not a synucleinopathy is present. Thanks for your time.